Rogers, and on behalf of the ADDitude team, I'm so pleased to welcome you to today's ADHD Experts presentation titled Teen Driving Rules, ADHD Guardrails to Avoid Distractions and Accidents. Leading today's presentation is Dr. Artiga Garner. Dr. Garner is an associate professor at St. Louis University and a licensed clinical psychologist in Missouri. Her clinical and research expertise is in ADHD across the lifespan, with a particular focus on the impact of ADHD on driving. In today's webinar, we will discuss the driving risks associated with ADHD and how to navigate them. As the parent of a 15-and-a-half-year-old myself, I am asking the same questions that you are. Is my teen ready? Will they ever be ready? Our expert will also discuss the Focal Plus training program, which she co-developed. We'd like to begin today's webinar by asking you all a poll question. What strategies have you found to be most effective in helping your teen with ADHD or yourself drive safely and confidently? Please select the option that best applies, and then you can always comment in the text box under the video player to tell us more. For answers to common webinar questions, including how to access the slides, the transcript, the certificate of attendance option, you can always click on the FAQ tab of your webinar screen. If you're listening in replay or podcast mode, visit ADDitudemag.com and search podcast 455 to access the webinar resources. And if you support the work we're doing to strengthen the ADHD community, please visit ADDitudemag.com/subscribe and sign up for ADDitude Magazine for yourself or to share with someone else who could benefit from greater ADHD understanding. Subscribe now and you'll receive our summer issue, which is dedicated to helping moms with ADHD and to probing the impact of hormonal changes throughout the lifespan from puberty to post-menopause. Click the magazine tab on the screen to learn more. Finally, the sponsor of today's webinar is Brain Balance. Brain Balance is an integrated cognitive development program designed to help kids, teens, and adults with ADHD, learning differences, anxiety, and beyond improve focus, attention, and behavior. Brain Balance creates a customized plan based on your child's needs to support their social, emotional, and academic growth. An exploratory study with Harvard's McLean Hospital found the Brain Balance program to be as effective as low-dose stimulant medication in alleviating ADHD symptoms in children. Scan the QR code on your screen or visit brainbalance.com to learn about Brain Balance today. ADDitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without any further ado, I'm so pleased to welcome Dr. Artiga Garner. Thank you so much for joining us today and leading this really important discussion.
Thank you. Thank you so much for having me. I am really excited to be here today to tell you about what I think is a really important topic. And I think you all do as well, as evidenced by how many people are here today. I also have a personal interest in this, so professional and personal. I have 2 children with ADHD myself. They're not driving age, but this is a topic that's very important to me as well. So I want to set the agenda because we're going to cover a lot of ground today. I'll spend some time telling you how ADHD impacts teen drivers. We will talk about factors that lessen risk as well as increase risk for driving issues in teen drivers with ADHD. I'll present on 2 interventions, research-based interventions that have been shown to improve some aspects of driving for teen drivers. And then I'll share some practical tips with you as you navigate this important developmental stage for your children. Oh, I am having a, there we go, next. Okay, so how does ADHD impact teen drivers? So the early studies involving adult drivers with ADHD were really startling, and you may have heard some of these statistics. So Barclay's study in 1993 reported that drivers with ADHD were 4 times more likely to be involved in a motor vehicle crash than drivers without ADHD. This comes with an important caveat. So this study was these children or adults, they were recruited as children, were recruited in the late 80s. And so if you think about what we knew about ADHD at the time, children who were referred for ADHD assessments and treatments in the late 80s were oftentimes the children who were most impaired by their ADHD, who had more severe symptoms. And so we think about this sample as being somewhat biased. This is a clinical sample, not only a clinical sample, but probably a highly sort of impaired clinical sample. Since then, we have had a lot of other studies who have shared that, more research has shared that there is a less dramatic statistic, but still concerning. So ADHD diagnosis does double risk of motor vehicle crash among teen drivers with ADHD. It's not as startling as that 4 times more likely, right? Simulated driving affords us the opportunity to look at the driving skills of these teens. And we do know that teens with ADHD exhibit poor simulated driving performance, particularly their ability to stay within their lane when they're driving, but also other aspects of driving performance, like maintaining a constant speed than teens without ADHD. When we look at the driving records of teens with ADHD have more fines than their peers, and they have higher points on their driver's licenses than their peers. When they have to take remedial driving lessons, they need to take them for longer periods of time. So together, this research suggests that the kinds of citations that teens with ADHD are receiving are more severe than the types of citations that teens without ADHD are receiving. And newly licensed teens with ADHD are 3.5 more times likely to drive under the influence than teens without ADHD. Okay, so if you weren't nervous about your teen driver before this, you probably are now. But what I want to highlight is that not all teens with ADHD fall under this problem driver sort of category. We know that as a group, teens with ADHD are more likely to experience these difficulties. But when we look at individuals with ADHD, we don't see that all individuals with ADHD experience these problems. If you think about other areas that we know about, like, for example, children with ADHD as a group are more likely to experience learning problems. But many of you have children with ADHD who do not. They receive great grades. They're maybe even in advanced courses or gifted courses. So we see a lot of variability among children with ADHD in other domains of functioning, and that's true here as well with driving. In a recent study that we conducted, we followed 76 teen drivers with ADHD in their naturalistic sort of driving habits. We had a camera in their car, and we were recording events, abrupt events, where they were braking hard or speeding up quickly. Out of these 76 teens, 2 teens had no abrupt driving events. And even going over kind of quickly over a speed bump can cause an abrupt event. So 2 teens had 0. 72 teens did have an event. In total, there were almost 3,000 abrupt driving events. But when we looked at each teen, it ranged from a teen having just 1 event over the course of the entire year to we had a teen who had 166 events. So most of these events were not serious. 94.4% of them were not a crash or a near crash. When there were crashes or near crashes, they ranged from 0 to 10. So again, some teens, like it just depended. Some teens really exhibit this problem and others don't. So what I want to highlight here is that the risk is probabilistic. Yes, there's a statistical likelihood that it's more common among teens with ADHD, but it's not deterministic. Not all teens with ADHD will experience driving problems. So you may be wondering, all right, well, what increases risk for these driving problems? I categorize these risk factors into 3 sort of components. One is individual factors. So some of the research we've done has identified that teens who currently meet diagnostic criteria for ADHD are the teens that are at risk. So some of you might have children who were diagnosed in elementary school, and their symptoms have lessened over time with development, and the impairment associated with those symptoms has reduced because they've learned strategies to manage their symptoms. So those children as teens don't have higher risk for driving issues. It is the teens who continue to meet diagnostic criteria for ADHD who have those issues. Specifically, if you might be wondering, is it the inattention that puts them at risk, or is it the hyperactivity, impulsivity that puts them at risk? And there's evidence that both of these symptom dimensions contribute to higher risk of driving issues. About a third of children with ADHD also receive a diagnosis of oppositional defiant disorder or exhibit rule-breaking behaviors. And those behaviors and symptoms increase risk. And that makes sense. If you have a kiddo who resists rules, who breaks rules frequently in other contexts, then it's more likely that they might break driving rules as well, that put them at higher risk for a driving issue. Interestingly, depression carries its own independent risk. I'm not aware of any research that looks at the comorbidity between ADHD and depression and its risk associated with driving, but we do know that depression on its own increases risk for driving issues. And the same goes for autism spectrum disorder. We know that independently, ASD is associated with greater driving risk and driving problems, but we don't know much about the comorbid presentation of ADHD and autism spectrum disorder. And then finally, we really don't know much about anxiety, again, and ADHD and its relationship to driving, but we do have some evidence that certain anxiety disorders do increase risk for driving. Relational factors also can increase risk. So if your teen has friends who break rules often, they are also more at risk for driving issues. And that makes a lot of sense. Parent factors can also influence risk. So parenting behaviors outside of the driving context, like monitoring, just generally knowing where your kid is, where they're going, who they're going to be with. Low levels of monitoring are associated with increased risk. And then having higher levels of parent stress, and this might be related to monitoring. If you are a parent who is very stressed out, then it's going to be harder to keep track of and stay on top of monitoring your teen. Environmental and contextual factors also increase risk. So a driving simulation study with drivers with ADHD found that monotonous roads, like highway driving, increased risk. And that makes a lot of sense. They're pretty boring. These are boring situations. And so they don't pull the attention of the teen driver. So if you live in a rural area where there's not much around in the driving environment, there's not a lot of stopping and going, then that could be a risk factor for your teen. Distractions are a risk factor for everyone, teens especially, and then teens with ADHD as well. Because teens with ADHD already are experiencing challenges with driving, if you add distraction on top of that, then it makes that more difficult. And some of you asked questions before this webinar about automated driving systems. And this question is a complex one to answer. So in some ways, automated driving systems increase risk. And the reason for this is that it takes, again, the sort of the attention and effort needed to drive actually increases driving skills for folks with ADHD. So when we take out that sort of motivation to do it, teens with ADHD drive worse under automated driving. So there's two ways that this was measured. One was attention maintenance, or being able to keep your eyes on the road. That's just a fancy word for that. So they looked at how does automated driving affect someone's ability to keep their eyes on the road. And they found that for individuals, all individuals, whether they had high or low symptoms of ADHD, using an automated driving system led to longer glances away from the road. And later we'll talk about long glances and their relationship to ADHD and driving and how they're problematic. Another study looked at hazard anticipation. So how does automated driving affect one's ability to anticipate where there might be a driving safety event. So we all might have in our own community an intersection where many people kind of roll through that intersection. And as an experienced driver who has good hazard anticipation, you likely do something to make sure that you pay attention in that moment. So you likely, as you're pulling up and stop, wait a little bit, take a beat and see what that other driver is going to do before you go through, even if you had the right of way. That's an example of good hazard anticipation. Automated driving systems reduced hazard anticipation for all drivers, whether they have low symptoms or high symptoms of ADHD. So again, this is another risk factor. In that same study, they looked at driving, other indicators of driving safety. One of them was driving speed. And so while the automated system reduced hazard anticipation, it did reduce driving speed for folks who had high symptoms of ADHD only. And the difference in driving speed when they were using an automated driving system versus not, the authors reported, was the difference between a fatal crash and a non-fatal crash. So automated driving systems in many ways present as a risk factor, but in some ways might be a protective factor. So it's really difficult to know right now whether or not this is something that, could be consistently used for folks with ADHD. So then you might be wondering, well, what can I do to decrease the risk? Well, at the individual level, stimulant medications, there's been many studies that show the stimulant medications improve the driving abilities of individuals with ADHD and reduce crash risk in naturalistic driving. The important thing to note here is that they're only going to be effective while they're active in your system. So we know that some stimulant medications can take a while before they go into effect after you've taken them. And so you want to wait until, you might want to wake your teen up early so that they take their medicine in time for them to have it in their system when they're actually driving to school. And similarly, when teens are driving home from school, that might be another gap. Their medication, if it's a long-lasting medication, might be wearing off at that time. So it's important to talk to your pediatrician or prescribing doctor about that, about the fact that your teen is driving and that you want to make sure that they have good coverage while they are driving. And they might have some ideas for what to do about that, including a booster. Another factor that decreases risk. So I talked about parents as a potential factor that could increase risk, but the good news is that we can also decrease risk. So children and parents who had a stronger parent-child relationship had fewer driving issues. And this was pre-driving age. So it's important to work on that parent-child relationship early in development. Parents who had lower stress levels also were reduced risk for driving issues. This one is really important to start thinking about early as well, parental modeling of road safety. So talking to your young children about the importance of paying attention while you're driving, saying out loud that you're going to put your cell phone away so that you're not distracted when you get in the car. Not answering that phone call while you're driving, just showing good modeling of safe driving. And then setting clear limits for road safety with your teen. Be really clear about what you expect. No cell phones while driving. No peers in the car until a certain age or a certain level of experience. Definitely no driving, after taking substances. So setting very clear limits. And I'm going to give you some tips for how to do that. And then under environmental or contextual factors, again, the driving environment. So a driving environment that is more engaging, like stop and go, urban, city driving is actually more engaging to the teen, and they're more likely to drive more safely. And then using, though I know many cars don't have a manual transmission anymore, using a manual transmission car actually is protective. We saw studies have shown that driving is better and more safe when teens are using a manual stick shift car versus, an automatic. So these are simple things that you could do to reduce risk in your teen. So now I'd like to share with you some interventions for teen drivers with ADHD. And these are interventions that have research evidence behind them. And so there have been 2 main studies that have produced some effects on driving safety for teens with ADHD. The first one I'm going to tell you about is the Supporting a Teen's Efficacy Entry to the Roadway, or STEER program, by Greg Fabiano, who's at Florida right now. So this study was an 8-week intervention that involved 3 to 4 hours per week of training with the teen and their parent. So the teen practiced developing their driving skills in a simulator, and the parent was present and learned how to teach their teen how to drive in a positive manner. They also implemented or used in-car technology in the teen's car to monitor their risky driving. And then they would review risky driving events with the teen and their parent, and teach the parent and teen how to communicate about these events. So parent-teen communication skills was another target. So this is a very comprehensive intervention that addresses many issues that are related to teen driving. One of the important components was the development of a driving contract. I'm going to tell you more about how you can set some of those up and give you some ideas for that. Okay, so the STEER findings. They recruited 172 teens with combined type ADHD. So that means that these teens had both significant symptoms of inattention and hyperactivity, impulsivity. And they randomly assigned them to either the STEER intervention or a driver education practice program. And the teens in the STEER intervention they had improvements in the parents' own behaviors during practice. So parents exhibited fewer negative comments during practice at the post-assessment and a 6-month follow-up after this intervention. Teens themselves reported that they engaged in fewer risky driving behaviors post-treatment and 6 months later than teens who were in the driver ed practice program. So that's great. Unfortunately, there was no effect on the naturalistic driving risky events. So again, they had a camera in the teen's car for 3 months in this study, and they looked at those abrupt events. And there was no effect of this intervention on those abrupt events in that study. What's key here is that it was a 3-month observation period. And I'll tell you about our study. We followed our teens for 1 year. So I think it really has more to do with the fact that they likely didn't follow these teens long enough to see an effect. But these are very promising findings. So I want to tell you about a study that I was involved in, the Focal Plus intervention. So this study targets attention maintenance or visual inattention. Visual inattention has been found in non-ADHD samples to be responsible for a significant portion of crashes and near crashes. So what happens is that 78% of crashes and 67% of near crashes are preceded by a look away from the road that was greater than 2 seconds. And this 2-second number seems to be magic. 2-second glances lead to 3.5 times more lane departures. So you might be thinking to yourself, well, why would anyone look away when they're driving? But we all look away when we're driving. Sometimes we look away for driving related tasks like checking our mirrors, looking at the speedometer, looking behind us before we merge into another lane. These are all driving related lookaways. We also sometimes look away for brief moments to do something that's non-driving related, like change a radio station. Hopefully you're not looking at your phone, but that does happen. So how do we do this? We do this by engaging in something called timesharing. So timesharing is when we look away from the road very briefly in these quick repeated movements, saccades, until that task that we need to complete is completed. So this is what that looks like. In this figure, someone's looking at the radio when they're adjusting it and while they're driving. So on the x-axis is time in seconds, and on the y-axis, or up and down, is the distance from the center of the road. So 0 is looking directly ahead at the road. And hopefully that's what most of us are doing most of the time. So you can see that before adjusting the radio, this driver was looking at the center of the roadway because they're around zero most of the time. Once they start adjusting the radio, the negative values indicate that the driver is looking inside their car. So once they start adjusting the radio, you can see that they briefly look down and then look back up, briefly look down and then look back up to the center of the roadway. So this is an example of effective time sharing when engaged in a secondary task. What we know about time sharing is that these skills are learned. So experienced drivers on average keep their glances away from the road under 1.5 seconds, around that time period. Teen drivers on average are beyond that 2-second threshold. So with more experience, teens become better at this. So another study reported that scenarios with glances greater than 2 seconds, experienced drivers usually have about 20% of the time that they look away, they have these extended eye glances, whereas teen drivers, over half of the time that they look away, they're exhibiting an extended eye glance, which, remember, is associated with increased risk. So our previous work had found that these extended eye glances, or visual inattention, is a key mechanism or explaining factor for why teens with ADHD have driving issues. So we had found that teens with ADHD had higher rates of these extended eye glances than teens who did not have ADHD. And we already showed you teens in general aren't very good at this. And that extended eye glances explain 20% of the risk associated with having ADHD and showing poor driving skills. So this led us to think, if we can address this extended eye glance problem, then we can maybe remediate a lot of the risk associated with ADHD and driving. So we turned to the literature and found that there already existed a program that addressed extended eye glances for neurotypical teens. This program is called Focus, Concentration, and Attention Learning, FOCAL program. So this program was developed with teen drivers who were trained to reduce their extended eye glances using a PC computer. So they would, on this PC computer, practice looking away from the road quickly and then looking back at a video of a driver driving. It was done in a single session. So 40 teens were randomly assigned to focal or a control group. And then 4 months later, they were assessed again. So teens who had been in the focal group 4 months after their one-time training, only 19% of their glances were extended glances. So if you think back to the statistics I told you before, experienced adult drivers exhibit extended eye glances 20% of the time. So these focal teens, their extended eye glance behavior was normalized. It was similar to that of an experienced driver. Whereas the control teens showed that 29% of their glances were extended eye glances. So we thought, great, this program already exists. But we knew as clinicians who have worked with teens with ADHD that we would likely have to adapt this intervention, because the key features of effective ADHD interventions contain or address 3 issues. First, they need to be as close to the real experience as possible. So we know from social skills training that children with ADHD, what they learn in a social skills group in a therapy context usually does not generalize to the real world. They need to be practicing with kids, in the real world. They can't practice with a therapist. That's not going to be as effective. So we wanted to approximate real world conditions. So we did the focal plus training in a driving simulation environment. We needed to give them immediate feedback. So we gave them auditory feedback when they looked away from the road for too long. They heard a beep. And then we needed to make sure that it was generalizable. So measuring extended eye glances and measuring driving behaviors in the simulator wasn't going to be enough. We needed to know, does this translate to real world driving? So this is a video of the Focal Plus intervention. You see that red circle there, that shows where the teen is looking when they're driving in the driving simulation. And then we had them do a secondary task that involved looking at a console in the center of this driving simulation. And so when they do that, you will see that their eye glances shift to the center of the console. In this video, which you'll get to watch later, I can't show it to you now, it will be available to you later. When they look away for too long, you'll hear an auditory beep that the teen heard. And it kept going until they returned their eye glances back to the roadway. So that is how the focal intervention worked. Our control intervention was a driver's ed sort of intervention. They conducted their training on a PC, they did some quizzes, and then later they practiced driving in the simulator as well, similar to the teens in the focal intervention, but they didn't get that auditory feedback when they were looking away from the road for too long. So I'm going to breeze through this here very quickly. We had 76 teens in both conditions. We measured their driving in a simulator before they got the intervention, then at 1 month post their last training, 6 months post their last training, and we also observe their naturalistic driving using this in-car drive camera that recorded what happened in their car when they had an abrupt event and what was going on outside of their car when they had an abrupt event. We followed them with this naturalistic observation for a year. And what we found was, so our focal teens are in the dark blue, focal plus, and the control teens are in the light blue. And you can see that focal teens, over time, their number of long glances reduced significantly, and they were different from the control group over time. And in terms of this, their driving performance, their ability to keep their car in the lane, we saw that they had less variability, meaning they had better control of their car over time, the focal plus teens, these teens in the dark blue, compared to teens who received the control intervention all the way out to 6 months. So these are great effects. When we looked at their naturalistic driving, we found that teens in the focal plus group, they had 24% fewer extended eye glances, and we reduced their crash risk by 40% over the course of that year. So these are great findings. We're very excited about that. Here recently, we've wanted to know, well, who benefits the most from the focal plus intervention? Might some teens benefit from it more? So younger teens with ADHD, they had a license, but they were younger. They benefited the most from the intervention. And then teens who had better executive functioning skills also benefited more from the intervention. The control group gave us the chance to understand what happens to teens who don't get an intervention over this course of the year, right? And what we found was that teens who were older over the course of the year, they got their driving worsened over time without an intervention. Teens who had lower IQs, now to be involved in the study, you had to have at least an IQ of 80. And so these are still, all teens had average IQ, but just on the lower end of average. Those teens driving worsened over time. And teens who had any internalizing disorder, generalized anxiety, PTSD, they also had worse driving over time if they did not receive this intervention. So in summary, this intervention, which is a 5-session intervention, each session is 90 minutes long, reduced extended eye glances away from the roadway during driving simulation and during naturalistic driving. The intervention seems to be most effective for teens who are younger and who have better executive functioning skills at baseline. And during 1 year of real world driving, the focal plus teens reduced their crashes by 40%. So you might be asking, all right, sign me up. Where do I go? Unfortunately, the STEER intervention, I reached out to Dr. Fabiano. That intervention is not available clinically, but the strategies that we talked about, communication training, developing contracts, practice, all of those things can be done and can be supported by a therapist. The Focal Plus intervention is available at Cincinnati Children's Hospital Center for ADHD, where the study was conducted. I provided a link here for you, and you will receive it in a follow-up email. Unfortunately, it is not covered by insurance at this time. The intervention in total for the 5 sessions costs $500. We are in communication, and we're finding ways to try and make this intervention more accessible to folks. It's only available at one site. We are looking at developing a Focal Plus intervention that is delivered via VR, because that could be easier to implement in various settings. Okay, so you might be asking yourself, should I let my teen drive after we've talked about all of this? Now, I would just want to acknowledge that this is a very sensitive issue, a very sort of parent-family decision to make. And so you might want to know what the experts say. And this paper that I'm referencing here, Adewin et al. In 2019, included the opinions of several experts on this topic. I was one of them. And all of us agreed that obtaining a permit and having lots of supervised practice is very important, and that we would recommend that you do that. We did not agree on whether independent licensure was appropriate. So what we recommend is doing a cost-benefit analysis, taking into account all the factors that increase risk. Those experts that did not recommend it felt like the research suggests that the risk is just too high and deadly potentially, right? And so they recommended just wait until they're older, their brains are more developed, they are more mature. And so I've given you all the reasons, I think, today why you might say the risk is too high for my teen. I'm going to give you some information that might counter that. So individuals with ADHD, we have research that shows that they obtain their license at later ages than their peers, 3 years later, essentially. To address the teen driving problem, all 50 states have developed a graduated driver's licensing system, GDL system, but how they are implemented really varies. So comprehensive GDL systems have all of these sort of bullet points here: minimum age of 16 years old for a learning permit, hold that permit for at least 12 months. You can read the rest there. What I want to highlight to you is that states vary in terms of how they implement the GDL system. Some states require that all teens, all novice drivers have a permit stage regardless of their age. So even beyond 18, if it's your first time getting a license, you need to go through this GDL system. Whereas other states like Missouri, where I am, 18-year-olds can obtain a full independent license without the permit system. And the permit system, what it does is allows teens to gain practice in a safer context. There are rules about how many peers they can have in the car. There are rules about not being able to use cell phones while driving. There are rules about not driving during risky times of day, so, late in the evening. So if you delay your teen obtaining their license, their independent license, until they're full adults in some states, they might miss out on this GDL practice period. Okay, so questions to ask yourself as you're making this very personal family decision. I would encourage you to ask, do I have a hard time setting limits and enforcing limits with my teen? Does my teen break rules often? Do they hang out with other teens that break rules often? And does my teen make good decisions in high-risk, high-reward situations? If your answers to these questions are no, then you might want to take some time to help and seek services so that you can start to address some of these challenges with your own ability to set limits and also just sort of communicating and enforcing rules with your teen. I would encourage that you do that. So if you're going to be navigating driving, or you'll navigate driving at any point. So regardless, I would say set a good example for your teen early. So talk out loud about your driving safety habits. I'm going to put my seatbelt on before I start the car. I'm going to put my cell phone away so that I don't get distracted. Say these things out loud to yourself so your teen can hear you do that. Break down the driving task into components. Start first in less busy environments, less complicated environments, less clear weather conditions during the daytime. Intersections. Start with easier intersections first, working up to more complex. Practice what to do in emergency situations. Overlearn, over practice. Children's Hospital of Philadelphia website has lots of great tools and logging tools for how to break down driving into steps and components. I really encourage you to take a look at that. Other tools, so technology tools that report safety sort of behaviors in your teen. You could use a third-party app like Life 360. I also included a link here for other potential third safety technology tools. And then behavioral contracting for safe driving. This is a method for you to clearly articulate your family's rules about safety and ahead of time set up fair and consistent limits and consequences for breaking those rules. Children's Hospital of Philadelphia offers examples for teen driving contracts. Now, some of you might really struggle with the communication piece of setting up a driving contract. So you can bring this with you to your therapist and work on those communication skills and ask them to help you navigate setting up a driving contract with your teen. So that brings me to the end of my presentation. Thank you again for allowing me to share this work with you, and I look forward to answering your questions.
Thank you so much, Dr. Garner. Before we head into the Q&A, I just want to very quickly thank Brain Balance once more for sponsoring today's webinar. We can share the results from today's survey. Now, many of you do have younger kids who have not started training yet, so you're not sure exactly what's going to work, but it seems like more or less a dead tie with encouraging your teen to take driving lessons with a professional instructor being the most successful strategy. Regular driving practice, again, it's that sort of rote, repeated action, providing a calm, supportive environment and avoiding any unnecessary distractions in the car. And then the fourth, waiting a few years until their executive functions mature. So those were all pretty much tied, and they tie in very well with a lot of the messages we heard from you today and out of the research. So you guys listening, you know more than you think you do. You're on the right track. I did want to ask, you spoke a little bit about in the focal training that it was proven most successful with teens who were on the younger end. What does that mean? At what age would be sort of the ideal time for a teen with ADHD and, somewhat sort of restricted executive function skills to participate in a program like Focal?
Yeah, that's an excellent question. So when we say younger teens in the study, teens had to have their own license. So they had to be out of the permit stage. So they were at least 16 years old to be in the study. So younger in our study meant, 16, around that age. I think it's an interesting research question. And it's something that, we are considering is seeing if Focal Plus is effective or helpful for teens in the permit stage. One of the explanations we have is that maybe the older you are, the less effective time-sharing sort of habits you've developed. And if we can teach you these habits earlier, then maybe we can prevent you from developing ineffective time-sharing skills. So that's our hypothesis right now. We don't know for sure. But in our study, it meant, teens who were around 16 or so.
Gotcha. Okay. And you also mentioned that having executive skills at a baseline that were not severely impaired. Does your research say anything about which executive functions in particular are more critical here?
That's a great question. So because in that study, we were looking at lots of potential factors, we kept it really general. And so we used a measure called the brief. That's a rating scale. So we didn't use computerized testing or anything like that. And we used the scale from the brief that measures overall executive functioning. So we weren't able to get down to specific executive functions in that analysis. So we can't say for sure. We just looked at overall executive functioning.
Sorry, that mute button. Okay, that is helpful. And the big question regarding Focal is whether there are any plans to adapt it for an online format so that it is more widely accessible.
Yeah, that's a great question. We really feel like The experience of driving, feeling the steering wheel, the pedal, that's important. Remember, I mentioned that one of the 3 components of effective ADHD interventions is that it really sort of approximates the real world, which is why we were thinking VR might be a good way to go, because it is more accessible. We could potentially, it'd be easier for driving schools to use, for example. And we can get like the, steering wheel and make it a little bit closer to the driving simulator. We haven't considered other like web-based, but that's a great idea. This is one of the exciting things about being able to present to you all. You've presented, your audience has presented excellent questions that lead to more research ideas for us.
Oh, that's great to hear. And you answered another question that we got today, which was about the potential for VR. That seems like such a great utilization of that technology.
Yeah, we are collaborating with experts in that area. That is not our area of expertise. And we are looking to develop that further. We're also looking for funding for that. So we're always looking for ways to be able to do that. But funding is a major challenge when it comes to developing these kinds of interventions.
Okay, so call your representatives, everyone.
Please do.
And, along these lines, a number of parents are wondering whether there is any research that you're aware of about positive impact that video gaming might have on things like twitch reflexes, response time. In some ways, could a video game habit make a teen a safer driver? Is there any research at all, or is that just wishful thinking?
That's a really interesting idea. I could see where maybe it could affect reaction time, but what we're finding from our research is that like the hazard anticipation skills, focusing on reducing those extended eye glances, the gaming, if it doesn't involve those components, I'm not sure that it would necessarily make a big difference. And then my concern is that a lot of these games, the point of the game is to do sort of risky things, right? Like drive quickly. And so I would be concerned that it might be reinforcing some, less safe driving habits. But maybe, I think if gaming could be used to address the things we know improve safety, like attention maintenance and hazard anticipation, then maybe.
Interesting. Yeah, it seems like an area that could use more research. Okay, this was a very interesting question. I've seen driving schools with certified ADHD instructors, someone wrote in, but they don't share precisely the details of those credentials. Have you heard of such a thing? Is there, in fact, a certification that you know of for driving instructors to be ADHD, certified?
Yeah, I've heard of that as well. And actually, I have an email from someone about this, an instructor, certified instructor. And it is on my to-do list to reach out to this person and learn more about it. I don't know anything about it, actually. And I have looked into the literature, and to my knowledge, there isn't any research that has examined whether using these kinds of instructors, improves driving abilities of teens or reduces, risky driving later on. So I am not aware of any research that supports the use of those, though I can understand that just using driving instructors sort of takes out, if a parent and a teen have had challenges with communication in the past, I think learning how to drive is a situation, it's just a very emotionally charged situation where it could be even harder to, remain positive and supportive in that environment. And so I could see where it would be really helpful to kind of take yourself out of that equation, have another adult who has experience teaching teens to drive to step in and take over. So I can sort of intuitively see how that might be helpful. But again, I don't know of any research that supports, especially the folks that are sort of claiming that they have certification or specialized training. I don't know.
That's very helpful. we did have a number of people here who said they've, older teens or young adults who are actually terrified to drive, whether they experience some early, small accidents, or they've just thought about it a whole heck of a lot. Do you have any advice for helping those folks help their young drivers overcome that fear, gain confidence behind the wheel, obviously while maintaining safety?
Yeah, I think that raises two important issues. I think the first issue is around how we talk to our children about their ADHD. And so I think about balancing telling our children sort of the realities and the risk factors associated with ADHD, and not overwhelming them with these realities and risk factors, and sort of presenting a doom and gloom kind of perspective on their life. And so lately I've been turning to the racial socialization literature. So this is research that looks at how do Black parents in particular talk to their children about the realities of being Black in America, and without overwhelming them or being overly negative. And what that literature suggests is that parents talk to their children about positive aspects of their identity first. When they're young children, they focus on positive cultural aspects first. And then as they get older, they talk to them about other things, that other challenging experiences that they might encounter. But they've kind of built up who they are and their identity before they talk about that. So when I think about ADHD and talking about ADHD with our kids, for those of us who have known about or had the diagnosis early on, I think that offers an opportunity to talk about ADHD from a strengths perspective, some like creativity, excitability, focus on things that you really like first in their development, and then talk about some of those challenges and risk factors that realistically they are going to or are likely to encounter, but having built up that sense of self first. So I think that is one thing we can do. A second thing is, like with any fear or anxiety, avoidance only builds our fear and anxiety. It maintains it. And so I would encourage families who have a teen who's really, really nervous or very, very fearful of driving to practice in safe conditions for as long as it takes. And just the important part is practice under safe conditions until they become sort of more and more comfortable slowly over time.
Okay, thank you. I did want to ask you a follow-up question on the manual transmission. You had mentioned that it was proven to be sort of a mitigating factor, not entirely, but that it did improve safety. And I guess I would assume that's because it is simply more engaging. The act of paying attention to the car and shifting it requires more of your hands-on attention. Is that basically the gist of it?
Yeah, that's what the authors of that study hypothesized, was that, it was the fact that they had to pay attention to be able to use that manual transmission, which is why later studies that looked at automated driving were sort of concerned about that maybe the automated driving might take away that engagement that then would lead to driving issues. And that did happen depending on what we looked at. So the attention maintenance or hazard anticipation. Under the automated driving, we saw worsening of those skills.
Okay. We did, you talked a good deal about the distraction possible from, changing radio stations, fiddling with a phone, that sort of thing. But we know that on the flip side, music can actually help focus the ADHD brain. Are you aware of any research, or is there any reason to believe that listening to music while driving is in fact detrimental or helpful to a driver?
Yeah. I have seen in some there's one naturalistic study that I can think of that found that teens with ADHD, when they were dancing in the car, were more likely to have sort of these abrupt events. So when they were driving and sort of caught up in their music and started dancing, that increased risk. So I think it probably, beside that, I don't know of any other research. My hunch is that the type of music you're listening to would likely matter, and how it might affect your ability to stay engaged. So music that's going to make you kind of dance and excited, you might end up taking your hands off the wheel, or just lose focus on driving. So I would caution against sort of have conversations with my team about like, well, what kind of music are we talking about? And notice if this type of music kind of gets you too distracted compared to another type of music.
Right. And everyone is different. Some teams report that they study quite effectively to, Metallica, and other ones to to classical music with no words. So, right. You got to have that conversation about it. Mm-hmm. And let's see, we had a question here, which I think was very pointed. And that was, we have a listener whose son has their learner's permit, and they've been practicing driving. They're just about ready to begin solo journeys. And she's wondering, like, to what degree do I talk about all of the various scenarios that he could encounter? Being pulled over by police, handling a fender bender, getting lost, breaking down. Like, is there advice for walking that fine line between preparing your team to think about these things and just freaking them out?
Yeah, I definitely hear you on that. I think that under high stress situations, teens with ADHD who maybe already struggle with executive functioning might really struggle with problem solving in a moment that's going to be very new to them. So I think you do want to prepare your teen for things that are very likely to happen, right? Like maybe a fender bender or something like that. But I think one thing I might recommend is just saying it's okay for you to take a beat. You know what I mean? Like, something happened, pull over, take a moment and call us once you've stopped and pulled over, and we'll help you in that moment. I think that teens oftentimes in those moments forget that they have you available. And so I would encourage them. I think there are things we can prepare them for, but when in doubt, pull over, call us, and we'll help you through it.
Right. Good advice in life in general.
Yeah.
Pull over and call your parent. Yeah.
Yes.
Okay. Amazing. Let's see if I can catch one more. There are some parents wondering, like, gosh, there just is no simulator option anywhere near me. Is it okay to not have a simulator with my ADHD kiddo? Like, can we put all these things, all these safeguards in motion and still feel confident that our teen will get enough practice time? And is it a matter of just putting in more practice time than maybe the baseline recommendation?
Yeah, I think, and in that article that I referenced with experts in this area, everybody agreed, practice. So, and maybe stay in some of those practice stages longer. So even, like, for example, with the GDL restrictions, after, I don't know, maybe like 6 months in some states, you can have more peers in the car. But if I were in that situation, or when I am going to be in that situation with my kiddos, I will likely have a longer period of them, regardless of what the state says, having that rule in place of no peers in the car. Because I think more time with that would be helpful. I think doing as much as you can to safeguard against some of these difficulties is all that you can do, right? And so if you have access to this, if you're close to Cincinnati and you can do this intervention, great. But without it, what we do know is that what this intervention is targeting is those extended eye glances. So have conversations with your teen about extended eye glances and how serious they are. Now you have that video that you can show your teen of how long is a 2-second glance, like watch it with them and sort of have them internalize what 2-second glances feel like. And I think that removing as many of those distractions that could lead to 2-second glances would also be important. So talk to your teen about putting that cell phone in the glove compartment or using a third-party app that, automatically makes it so that they cannot answer the phone or use the phone while they're driving. But I think, I would recommend that you work with someone to establish these rules. A therapist could be really helpful, or talking with a pediatrician. Call ahead of time before the well visit and say, I want to have this conversation with you at our well visit. I want to talk about driving contracts and how to communicate about driving and driving safety. That way it's another person, another adult who's bringing it up and not mom or dad who's, being the bad person, bad guy and saying, oh, these are the rules. Someone else is bringing it up first. So I would recommend sort of using as many of those tools at your disposal to help you through that.
Those are some great pieces of homework for all of us to take from today's event. And that's a great place to end. Dr. Garner, thank you so much. This was such a thorough and also empowering presentation. We really appreciate your contributions.
Thank you. Thank you for having me.
Absolutely. And thanks to everyone who listens today. We hope you'll join us again. Next week, we'll have a free webinar on new insights and treatments for comorbid depression and ADHD. So to make sure that you don't miss any future webinars, articles, or research updates from ADDitude, you can sign up to receive our free newsletters at attitudemag.com/newsletters. We hope to see you all again very soon. Thank you.